can have an effect, a significant effect on both sportsmen and women, impacting negatively on them, both physically and mentally. Sometimes it leads to depression, anxiety, and a decreased sense of self-worth. Very good morning out there, and thanks for joining us on another brand new episode of your most educating sports program on television, Sports Health and Wellness. Reaching you from Moshood Abiola National Stadium right here in Abuja, the Nigerian Federal Capital City. My name is Tewase Ibeyema. And last week, we talked about managing acute injuries. Today's episode will be having a discussion on managing chronic injuries. Yes, these injuries begin from early stage, they get to acute stage, and sometimes to chronic stage. So on today's episode, we'll be discussing extensively, educating you on how you can manage or even prevent injuries from getting to the acute stage, chronic stage rather. And I'll be joined by a doctor virtually as the program progresses. But before we delve into the main discussion of today, I would like us to have a background report on the topic of discussion. Don't go away. We'll go for a quick break, and we'll be back. Welcome back. If you're just tuning in, you're watching Sports Health and Sports Health and Wellness. Everything you from NT Sports 24. And we'll take a background report by our very own Ijoma Peter Nwante before we dive straight into the main discussion of the day.
Sports injury is a condition that develops gradually over time as a result of stress or overuse. These injuries can affect any part of the body and can be caused by a variety of factors, including poor training techniques, inadequate warm-up or cool-down, or lack of proper equipment. The most common types of chronic sports injury include tendinitis, stress fractures, and sprains. Chronic sports injuries tend to be associated with the ongoing pain and discomfort, so effective pain management is vital. Chronic sports injuries can be managed with a combination of rest, medication, physical therapy, and other treatments. Manual therapies such as joint mobilization and soft tissue massage can each help to reduce pain and improve mobility. Rest and recovery are essential components of managing chronic sports injuries. It is important to give your body time to heal during this time. This may mean taking a break from your regular exercise routine or modifying it to avoid further injury. It is also important to listen to your body and not push yourself too hard, as this can prolong the recovery process. Hot and cold therapy can help manage the symptoms of chronic sports injuries. Also, the use of ice packs, heat pads, or hot baths can help manage symptoms. Practicing good nutrition and hydration are important for managing chronic sports injuries. Eating a balanced diet that includes plenty of fruits and vegetables can help provide the body with the nutrients it needs to heal. Staying hydrated by drinking plenty of water can also help improve your sports health and wellness. Ijoma Peter Wante, NTA News.
Thank you very much, Ijoma, for that comprehensive background report on how to manage chronic injuries in sports. Now, we will be trying to link up to our guest of the day, which will be joining us virtually. And his name is no other person but Dr. Yinka Olute. Dr. Yinka Olute is a renowned sports physiotherapist who has served Nigeria in different capacities, including the Commonwealth Games, Olympics, and the FIFA Under-20 World Cup. Doctor, a very good morning to you, and thanks for joining us on the program today.
Thank you very much. Thanks for having me on this program. Thank you.
We're discussing managing chronic sports injuries and long-term care with emphasis on the long-term care for recurring injuries. Uh, Talking about rehabilitation and prevention of future damages. And now, what are the most common chronic injuries in sports, and how do they develop over time?
Thank you. First and foremost, I'm a physiotherapist actually, so I'm not a doctor, but it's okay. So the I'll take the second question first, so I can define the first. Answer the first question. So how do they develop? So the word chronic means it's taking time. It's taking a bit of time to happen. There's acute injury, which is what most of us see on TV when the athlete gets injured and we run onto the field and we help them off and they cannot walk or get them some ice. That's acute injury. But chronic injuries happen over time. And how do they happen? They happen because the body, in the bid to do things we need to do, like shoot a ball, jump, block the net, give a punch or something, we need to use what we call the movement fundamentals. So range of motion, flexibility, strength, balance, and biomechanics. So just to simply define biomechanics to you is basically where biology and physics meet in the body. So they develop over time, and the patient usually has an injury he or she doesn't even know has happened. So slowly develop, it happens slowly, until a point comes when you begin to notice it. It becomes something that affects performance, And basic examples are things like tendinitis, stress fractures, osteoarthritis, low back pain, tennis elbow, jumper's knee. Yeah, just mention a few.
Managing recurring injuries.
So I didn't get that.
Important is rehabilitation in managing recurring sports injuries.
Oh, okay, thank you. Yeah, so rehabilitation basically is the process where the physiotherapist, as a member of the rehab team, tries to correct the issue that led to the injury in the first place. So rehabilitation is very key. You learn the movement, you teach the patient or the athlete the ideal movement, and you start the process all the way backwards. So you start by reducing pain and all those things. So rehabilitation is like relearning how to move, relearning how to jump, relearning how to do all those things. So you come in with the factors like muscle strength, balance, dynamic balance, static balance. So rehabilitation is like doing what happens on the field in the clinic. Yes, that's what I mean.
Okay. What role does prevention play in in reducing the risk of chronic injuries?
So prevention is a big topic, actually. So you have primary prevention for somebody who has never had injury. Secondary, for the person who has had injury before. So prevention is key in learning these things, and if you can learn how to move properly. So this is where the coach comes in, who would maybe regularly make corrections with, this the way you kick, the way you throw, the way you jump, you need to do this. So prevention is something that starts from the training ground with the coaches, the physiotherapists, and the doctor observing. So when you know how the body moves, so every sport is different. So that's why you have specialists in different sports. When you have, let's say, soccer, for example, which is the most popular sport in Nigeria, if you have a player who has a difficulty with dribbling, who has difficulty with kicking, who has difficulty with shooting and everything, for example, once you know this, once you see this, you constantly tell the athlete, look, the way you shoot is bad. So you can now, as a physiotherapist, bring a patient in, teach him how to maybe balance, teach him how to swing their arms, teach him how to swing their legs, timing and everything, to prevent something from happening ahead of each other. Maybe how to use the right equipment, like the boots, the gloves, and all the things you would expect to enhance performance. Yeah.
We are having a very educative session with you. But the discussion. Before we get back to you, I'll ask you another question. Let's.
We call RISE. Rest, ice, compression, and elevation immediately. That if athlete sustain an injury, that athlete need to rest. You will rest and ice the place. to avoid swelling. There should be compression, avoid swollen and pain for the athletes to continue in the activity.
In order to manage sports injury, first of all, I think the government needs to come in, judge athletes. Second, have a union and a contributory pause where they can use from the pause to assist one another when they retire or when they have.
The only area we can manage sports injuries is by organizing rehabilitation exercise for them. If possible, those who sustain such injuries to be properly taken care of. Incentive given to them to give them the courage to continue the activity. By the time you leave them alone to suffer the pain, to pay for everything that is involved, next time they will not be ready. But by the time you grant them one, you support them financially, you place them where they can manage despite the injury. I think the courage is there for them to do more next time.
For managing the injury, a child or an athlete, an individual is supposed to eat good, balanced diet, good nutrition. You know, we have some kind of food for athletes. These are the food that specialize for the athletes to be eating so that it will not make them to have injury when they involve in sporting activities.